I've read of people who are 98 years old that survived the Spanish flu that get COVID and are completely fine. And then there's a 25-year-old that died who was a college lacrosse player. In healthcare, we're all about models and predictions. So the fact that it tends to hit people in such a variety of ways is really scary.
Welcome back to a new episode of COVID-19 Heroes. I'm your host, Lorraine Schneider, and I am thrilled to have another nurse on our show today. Rachel Izzo works in an emergency room at a hospital in Seattle. During our virtual sit-down, she talks about how her region is currently affected by the virus after having been the first epicenter in the U.S. She also shares what makes this coronavirus so particularly challenging to deal with, and she describes how mindfulness and meditation is helping her get through this stressful time. Hi, Rachel. Thank you for being on today's show of COVID-19 Heroes.
Hi, thank you so much for having me.
Rachel, you are a nurse who works in the Seattle area, which was the first epicenter of COVID-19 in the U.S. When did you realize that this was going to be big for you?
It was a little bit before it actually publicly broke when I got sick with what I believe was COVID, but they weren't allowing testing at that point. Later, based on kind of clinical presentation and a couple of my colleagues' assessments of my respiratory status, they were convinced that I had it. But when I believed that I had it, we were kind of discussing amongst ourselves that we think it's been here for a long time already, but it just hasn't been public. And that was kind of confirmed when that outbreak happened at the Life Center in Kirkland. And it was really the next week, once that officially broke that it had been here, and there was kind of a mass panic amongst the public. And then in our own little ER, realizing that we were going to have to completely change our flow in order to protect ourselves and our patients. That was when I realized, I was like, oh gosh, this is going to really affect the entire hospital flow in every hospital in Seattle. And that was kind of when the stress of being in the middle of it kind of hit for everybody.
It's April 2nd as we're recording this. What has it been like in the ER in the last couple of weeks, and what do you foresee over the upcoming weeks?
So initially, and I've talked to other nurses in the area and even others in other cities that are kind of a little bit behind Seattle, and it's pretty much the same. Initially, there was a huge spike in the public coming in, kind of from mass panic, people wanting to be tested that didn't really even meet the clinical symptoms, but there was a lot of I don't want to say racism, but almost a little bit of racism. People saying, I walked by a Chinese person, I'm afraid I have COVID, which was a little shocking. I couldn't believe that was actually happening. And there was this mass panic and reaction to, what people, I think, have said is the Chinese virus, which is super racist and has caused a lot of racial-based crimes recently, not in Seattle, but that was kind of the initial surge of people who were just kind of in a mass panic. And then within individual organizations, emails were sent out to patients to say, please, if you're not truly sick, don't come in. We don't have the ability to test everybody yet. And that was primarily based on the central government's lack of response and preparation for the pandemic. We just didn't have enough tests. No one had enough tests. And then once our governor issued the stay-at-home order, there was an incredible drop off in the amount of people actually coming in, which was very unusual actually, because we're pretty busy. We're pretty consistently busy throughout the week. Obviously there's ebbs and flows, but this cut our census by probably almost 50%. In the initial couple of weeks, we had to kind of rework the entire flow in terms of how to isolate patients and protect other patients that might not be at high risk for having coronavirus, but might be at risk for catching it, how to protect them in isolation and how to protect ourselves. And once, and that's still a work in process, but once that kind of got figured out, we had a little bit more of a flow, and then the census dropped. So at this point, and I know it's the same, I think in areas of California too, we're kind of in this waiting game because we were the huge epicenter. And there is speculation that we got ahead of it, and the social distancing that was put in place has kind of flattened the curve a little bit. And then watching New York, we're watching what's going on with them. We're actually not even remotely close to what's happening there right now. But we're kind of all holding our breath, waiting for something like that to happen. And there's speculation. I've heard mixed opinions of whether that's going to happen or not. And at this point, we're just waiting. And sometimes the waiting is even more anxiety provoking than actually just kind of having it come in and work with it. So that's kind of where we're at right now. And again, really busy the first couple weeks. And then what we're also seeing is that because people are staying home, it's the complete opposite of what we usually see. People come in for kind of ridiculous things that they definitely don't need an ER visit for. And now people are waiting with serious issues. So it's kind of a flipping in a way, but we're still kind of just waiting for this surge that may or may not happen.
How many of the people who are currently coming to the ER are coming in because of COVID-19 related symptoms versus anything else that you typically see?
It kind of ebbs and flows. Like some days we're very heavy on the respiratory symptoms, and we kind of classify anyone as potential COVID if they have any kind of respiratory issues, fever, cough, anything like that, until we can rule other things out, obviously. And I would say it kind of ebbs and flows. Sometimes we're just slammed with the respiratory stuff, and then everything else kind of takes a back seat. And other days it's all other medical issues and no respiratory. But we do have some potential COVID patients every day, I would say. But the amount of people definitely is kind of like a roller coaster over the days.
In your opinion, what makes this virus so particularly challenging?
Definitely the amount and variety of symptoms that can present, and the fact that it seems to not have quite the same predictable pattern as other illnesses. What I tell people is that you look at something like the flu, everyone's probably had the flu sometime in their life, and any kind of viral illness like that, and even, obviously bacterial diseases, illnesses like that, you typically hit older adults more. And it's a predictable pattern. If you are immunocompromised, you're elderly, you tend to have a less of an immune response, or you have other chronic conditions or comorbidities, those people tend to get hit the worst, which is true for anything really. And younger people, young, healthy people tend to be spared. And then you have the other end of the spectrum, babies and newborns that don't have any immune system at all. What we're seeing that can be really tricky, just in terms of the people that it hits hard, is that there doesn't tend to be a set predictable pattern all the time. I've read of people who are 98 years old that survive the Spanish flu that get COVID and are completely fine. And then I read recently there was a 25-year-old that died who was a college lacrosse player. So there seems to be a little bit less predictability with how hard it hits somebody. And that creates a lot of fear, and rightfully so, because in healthcare, we're all about models and predictions and trends. And we don't know enough about this virus to see that quite yet. I mean, we're learning, but also the fact that it tends to hit people in such a variety of ways and in severity is really scary. In addition to that, the other fear factor is that there's just so many different types of symptoms that could present as COVID positive. Some people don't have anything really, or just a cough, or they lose their taste, their sense of taste or their sense of smell, which I just, recently read a couple weeks ago. And then they could be walking around with it, carrying it, and potentially going into some place that I guess not as much because everyone's socially distancing, but potentially spreading it to someone that could be really, really sick. And then you have the people that present with the severe shortness of breath and the cough and the bilateral infiltrates on x-rays. And that's the kind of the typical presentation. But what's so scary is that there's so many aspects of the symptoms that could be COVID or be something else that people just don't know that they have it or not unless they get tested. And initially that for me and other people that I work with is scary because a lot of us have older parents or live with someone that might be immunocompromised or have grandparents that are immunocompromised, and we just don't know if we are carrying it or not. So I think because I always use like tuberculosis as an example, which is a very scary disease, but it's, been around forever, essentially. I mean, for all intents and purposes, it's forever for me because I'm pretty young. But we know how to take care of it. I've taken care of a lot of tuberculosis positive patients, and it's a lot of prep and care because of all the precautions that we have to take and put into place. But it's a set algorithm and we know what to do. And because this is such a new virus that has so many different symptoms and so many different ways of affecting people, it creates a lot of fear amongst the community, but also the healthcare providers. So that's been the most challenging because we even have people who come in and they might not meet the algorithm that is currently written by the CDC for us to follow to be tested, but it doesn't mean that they don't have it. And I have to tell that person, like, just because you don't meet this algorithm doesn't mean that you don't have it, and you still have to be careful. And people want to get a hardcore yes or no, a solid yes or no answer. And we don't always have that because it's not like the flu where it's a simple, swab, you wait a few minutes and then you're done. So all those aspects make it really challenging as a person in a community that, and living with a parent that could potentially get really sick, but also as a healthcare provider taking care of patients that want to know answers that we don't always have the answers to.
Do you think that also increases the fear of a second wave once the stay-at-home orders get removed and we suddenly have more and more people get back together, allowing for the virus to spread all over again?
Yeah, I think that's definitely a possibility. And I think that's what the Seattle area in general is prepping for. I know that there was also speculation that this could die off in the summertime, but then there's also speculation that it might not, and it might still be persistent, and we might get hit with another wave in the fall. And really, I think the two biggest issues nationally right now are the shortage of ICU beds / ventilators, and then PPE. And I definitely think that is what Seattle and Washington in general is preparing for, is that second wave just in case. So we are ready. We're standing by. We're getting trained on how to use ventilators and set them up in case we have to. And I think that that's where we're all kind of holding our breath, waiting for that to happen, but hoping that it doesn't.
Right now, do you think your hospital has enough personal protective equipment and ventilators for everyone, or are you also part of the shortage?
I think everyone is short. So I use the example of, again, tuberculosis, because that's an airborne precautions. And if people aren't familiar with the different types, it's about different types of personal protective equipment for healthcare providers. We put PPE on based on how the disease is spread. So airborne is when we have to use the respirators, the N95 masks. And again, when I was in New York, I had a person with TB all summer. And the standard of that is that you use one mask and one N95, you throw it out every time, you leave the room, essentially. So you're changing your whole set of PPE each time. I don't think anybody in this country has that right now because there is such a shortage of masks. Compared to other places, I am extremely grateful for what we have because it is a lot more than some people in other states. So does it meet the criteria that we're supposed to do, that we're supposed to be taught in nursing school? No. Am I comfortable with it at this point? Yeah, because I've read and seen and just watched so many horrible videos of nurses, talking about what it's like at their hospitals right now. And some don't have any masks at all, and they're using a handkerchief or, something like that. They don't have gloves, they don't have gowns. So for me personally, I'm okay with what we have because I can see in comparison to what it's like in the rest of the country that we're in a luxury compared to other parts of the nation. But again, per standards, no one I think is up to standards right now in the entire country. But compared to what it's like in Detroit or New York, we're definitely way better off.
In your workplace or before when you were in nursing school, was a pandemic part of your curriculum? Have you spent much time studying such a scenario?
No. And what I've been reading too, especially with new nurses coming into the force like this year, everyone's saying we didn't sign up for this. And I think that I graduated in 2015 from nursing school. So I've been a nurse for 4 years. And I don't remember, I'm sure we talked about it at some point, but I never remember prepping for anything like this. Usually in school and orientations for jobs, you unfortunately recently have gotten prepped with mass shooting events and what to do with an active shooter or a mass casualty from an active shooter in the area. But I've never been educated on what to do in a pandemic. And I don't think any of us could ever imagine this in our lifetime. And my mom's a nurse as well, and obviously much older than me and been in the nursing force a lot longer. And everyone is saying like, we just never, and it was never on our radar. I think it's kind of like, if you ask people, I was 11 when 9/11 happened. If you ever could have thought anything like that would have happened in your lifetime, you would have said no. And I think this is kind of the same thing because we're not prepared at all. I think we should all learn about it. I think like reading about the Spanish flu, especially because that was a huge pandemic, is something that should be discussed, but it's never something that you would think you would see in your lifetime, and definitely is not part of the regular nursing school curriculum.
Do you think this period of a pandemic can positively affect healthcare workers in the long term?
I think that's a good question. I think that it's going to, so in terms of just the nursing front, one thing I think, from what I'm seeing in a positive way is that it's uniting nurses and uniting healthcare workers all at once. And I work with a lot of really great people. Everyone has a very different personality and, we all have our differences. But I think with this, there's been such a unity among just my coworkers, and I've seen it across the country as well, that's going to be something that's going to stay with people for a long time. And just putting nursing and healthcare workers in general in the forefront. I've seen so much kindness from people in terms of thanking healthcare workers, thanking frontline workers, people organizing donation drives. So in terms of just like the broad scope of humanity, I think that at least this blip in our history is going to remind people how important frontline workers are and how unnoticed they go. And none of us joined, well, hopefully none of us joined nursing to be thanked. It's kind of a thankless profession for a lot of us, but it's been really heartwarming to see so many people being forthcoming with their thanks and their gratitude and offering free yoga classes and just stuff to help us kind of cope with what's going on. So I'm really hoping that that will kind of change the perspective of a lot of people. And nursing goes on, without pandemics. And obviously this is a whole other level of stress in our career that probably none of us were ever thought we were going to see, but that our, nursing is a hard job and frontline work is a hard job in general. And just to have people be grateful and thankful for what we're doing and hopefully shift that perspective of healthcare. In terms of, like the kind of nitty gritty part of healthcare, I'm hoping that the centralized government will kind of learn from this and learn that it should have been better prepared, especially with kind of what was happening in China and watching that evolving, and that there will be better, I guess, policies and procedures in place from the central government to ensure better protection of nurses and healthcare workers if something like this happens again.
So earlier you mentioned coping, and I know that in your spare time you practice mindfulness and meditation. Is that what has been helping you get through this difficult time?
I do a meditation practice and I've been on retreats all around the world, and I have a very wonderful community that's been super supportive of everything that's going on, even if it's just sending, a kind word of thanks or, checking in, hey, how are you doing? A lot of these people that I'm friends with, they organize kind of global meditations where people from all around the world join in to kind of raise what we call the collective vibration of the planet to just kind of elevate the energy and the positive emotion of everywhere, the whole planet, to help people kind of cope with that. And, sending, energy to people remotely can be very powerful depending on what your practices are. What has been a challenge is that I love this community so much. And I think initially what was very challenging is that there was a very kind of hands-off approach, is that I saw tons of people saying like, oh, this is no big deal. Like it doesn't affect me. It's only going to affect the older population. People need to calm down and just stay positive. And initially I kind of was actually like that. I was like, this is ridiculous. It's not going to be that big. And then when it hit, I was like, oh, wow, this could be really big. And that was really challenging because I come from a belief that, we create our reality, and how we view ourselves and our world is what's going to show up in our lives. But I'm also in the middle of something that's really big in healthcare right now. And it was very dismissive, I felt, for people to sit behind a computer screen somewhere that was not affected and brush us off while we're really in the middle of it. And it was a really fine balance of saying, hey, like, this is actually happening and it might not affect you, but it's affecting a lot of people and we need your support. Because I feel like it's a very egocentric thing to say, oh, it doesn't affect me. Like, everyone just shift their attitudes to be more positive, when it's really affecting and killing a lot of people. I've had friends that have lost family members. So I've been, pretty forthcoming with kind of calling people out and saying, hey, like, this is very dismissive and it might not affect you, but we're being effective right now where I am and we need your support. To find that balance, to not focus on the negative so much, because it's so easy to get sucked into that spiral of reading all the negative stories. And that just makes your mood worse. Like, anyone can agree with that. But to acknowledge what's happening and then maybe do something, even if it's not affecting you, do something to support the people that are being affected, whether it's physically or energetically. So I've been really working with my community on that to help people see how they can help us and help the people that are being affected, even if it's not affecting them right away.
What is one thing that you think you will take from this on a personal and or a professional level?
Personal level, I want to help, right? So I want to jump in and I want to help and I want to be in the front lines because we're kind of called to do that. So for me, I'm learning that I want to be kind of, I don't want to say disaster ready, but I'm a young, strong, healthy nurse. I want to be trained to help out in a crisis like this. And I had a friend who was telling me it was when she was like full force in nursing when 9/11 happened, and she wanted to jump in and help, but there were so many mortalities that there was nothing for nurses to do. But for me personally, I realized that, I want to be a frontline worker and I want to help because I feel like I can. And it's going to make me kind of continue to pursue those career pathways where I could jump in essentially in the middle of a disaster and help out on the front line. So that's personally for me, I realize that that's kind of my conviction and my purpose is that I want to help, because that's, hopefully people join nursing because they want to be a helpful person and helping people in illness. But I realize that I'm kind of the calm in the storm, and I'm pretty good at doing that. And that I feel like I could be a really good help for people in crisis. So I want to continue to grow in that. And the same for my career. I want to pursue more pathways that would allow me to help more. So whether that's getting cross-trained in ICU nursing or going to a bigger ER and learning trauma and disaster management. And some hospitals have like infectious disease teams or whatever. There was an Ebola team at one hospital I worked at. So really kind of seeking out those avenues where if something like this happens again or continues to happen really because they don't know what's going to happen, then I can continue to jump in and kind of be that calm in the storm and help out in any way I can.
I love that. Well, Rachel, thank you so much for taking the time to sit down with me. I know that we're all thankful for you and all your colleagues who are working on the front lines currently.
Please, please, please send your love and support to the nurses and staff in New York and Detroit and Louisiana and the other places that are getting hit really hard, because it's unimaginable some of the things that they're going through right now. So I'm really grateful that we're doing okay right now. Again, I don't know what's going to happen, but there's a lot of places that really need that support. And if you know of anyone that wants to jump in on the front lines who is a nurse and wants to do travel or something, that they could really use the help out there.
Thank you, Rachel. To close off this episode, I would like to send a heartfelt thank you to our healthcare professionals, and just like Rachel mentioned, send positive thoughts to the most hard-hit places in the country. I hope you felt as much admiration for Rachel as I did, and if you did, I'd be grateful if you shared her episode with a friend. You can follow the show on Twitter and Instagram and subscribe to it on all major podcasting platforms. Thank you, and until next time, I'm your host, Lorraine Schneider.